Cough, types and character. Cough refers to the reflex act, a forceful expiration, against a closed glottis, that helps in clearing the airways, including foreign bodies. Two types of cough can occur in a patient, namely, dry cough and expectorant or wet cough. A dry cough is a cough that doesn't bring up mucus. Dry coughs occur because there's inflammation or irritation in the respiratory tract, but there's no excess mucus to cough up. Dry coughs are often caused by upper respiratory infections, laryngitis, tonsillitis, sinusitis, asthma, allergies, gastroesophageal reflux disease, medications like ACE inhibitors, and exposure to irritants such as air pollution, dust, or smoke. A wet cough, also called a productive cough or expectorant cough, is a cough that typically brings up mucus. A cold or the flu commonly causes wet coughs. Other conditions that can cause a wet cough include pneumonia, emphysema, and chronic bronchitis. Evaluation of the quantity and quality of expectoration must be performed. Conditions associated with minimal sputum production are respiratory tract infections and bronchial asthma. A large amount of sputum, more than 100 milliliters, is produced in case of bronchiectasis, lung abscess, and bronchopleural communication. Bronchuria refers to production of more than 100 milliliters of watery sputum within 24 hours. It is seen in chronic bronchitis and bronchoalveolar carcinoma. Mucoid sputum is gelatinous, sticky, and has a colorless, or white appearance. It is associated with chronic bronchitis and bronchial asthma. Serous sputum appears colorless and watery. It is seen in left heart failure and bronchoalveolar carcinoma. Purulent sputum is thick, viscous, yellow-colored, and denotes pyogenic infection. The color of sputum may give an indication to the underlying cause of cough. A yellow color of sputum indicates infections with pus-forming organisms like streptococci or staphylococci. In case of infection with mycoplasma-like organisms, the sputum will appear colorless. A green color sputum may occur due to vertoperoxidase, liberated by disintegrating cells. Patients with bronchial asthma may bring out green-colored sputum, even without infection due to excess eosinophils. Brown-colored rusty sputum occurs due to the dispersion of blood evenly in the sputum. It is seen in bacterial pneumonia, cystic fibrosis, and lung abscess. Black-colored sputum, also called melanophthisis, occurs in coal mine workers due to coal inhalation. Blood-tinged sputum is seen in pneumonia, tuberculosis, pulmonary embolism, pulmonary edema, lung cancer, cystic fibrosis, and use of anticoagulants. Coughing out of blood from the respiratory tract is called hemoptysis. Red currant jelly sputum appears bright red, viscid, and is seen in infection with Klebsiella pneumoniae. A sputum with characteristic anchovy sauce color is seen in pulmonary amoebiasis. Foul-smelling sputum is seen in bronchiectasis and lung abscess. It is suggestive of infection with anaerobic microorganisms. Quantity of sputum expectorated is more in certain body postures. The conditions associated with postural variation of sputum include bronchiectasis, lung abscess, bronchopleural communication, gastroesophageal reflux, and aspiration into the lungs and postnasal drip. Character of cough. Short cough is associated with upper respiratory tract infections. Attacks of cough with a metallic sound is called brassy cough. It is commonly associated with tracheobronchitis and mediastinal masses. A bovine cough is a non-explosive cough associated with low-pitched sound. It is accompanied by hoarseness of voice and is seen in vocal cord paralysis. Barking type of cough is found in epiglottal involvement, as well as in hysterical and nervous individuals. Whooping cough refers to a severe attack of prolonged cough. A characteristic whoop is produced due to inspired air entering through narrowed glottis. It is associated with pertussis. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.